What is migraines? To know the migraine, we have to go back to the days and hours before migraine, where sensitivity to light increases and the patient feels thirsty and tired, and the mood changes and sleep disturbance occurs. These warning signs point to a particular part of the brain, the hypothalamus. The hypothalamus normally controls the systems behind these symptoms. Our body's internal hormone balances circadian rhythms and water regulation. It has wide connections throughout the brain and is more active than usual in the days of. For a migraine, another common warning sign is the migraine aura, which can take the form of transience, visual changes, tingling, or even trouble speaking. These sensations come from a change in charge across cell membranes that leads to spreading changes in brain activity and blood flow across a brain. We do find out what triggers this change in pregnancy, but it can spread rapidly over the surface of the brain, causing different symptoms or symptomically depending on the affected area. If it moves over the visual cortex, for example, it can cause an image or blind spot to spread over the visual field. During the headache phase, attempts by the bacterial nerve play a major role, and the general nerve usually transmits touch, temperature, and other skin sensations to most of the face of the scalp and to some of the blood vessels and layers that cover the cerebral cortex. Once activated, the bacterial nerve tries to transmit pain signals to the jury. Migraine makes coughing, bending, light and sound painful, which are usually painless. As far as migraine is varied, it is common for 33% of women and 13% of men in their lives. Migraine is a disorder that affects parts of the brain such as brain scrutiny, cerebral hemispheres, and nerves, but it is not possible to know for sure why people get migraines while others do not. It is believed that hormones have a role in changing the pattern of migraines. For example, some women after menopause suffer from a decrease in the frequency of migraines, while before menopause migraine disorders increase and migraine may worsen. People with migraines are more likely to have strokes, sleep disorders, headaches, and depression. Heredity plays a role almost certainly, but some exceptions. There is no gene that causes migraines. Specific genes control how easily neurons in the brain excite stimuli and how easily they transmit signals. One thing is for sure, migraine is much more than a headache. But what then is a headache? Doctors have identified 150 types, each with different causes, symptoms, and treatments.